Hey everyone, and welcome back to KenkoVibe. I'm Ethan Reed,
And I'm Grace Morgan.
and we are so excited to be your guides for today's deep dive.
Yeah, into a topic.
That's often shrouded in mystery.
A little bit.
Low testosterone.
Yeah.
You know, we hear about it all the time,
We do.
but I feel like there's so much we don't know.
Mm-hmm.
So Grace, I'm ready to have my mind blown.
Okay.
Let's start with the basics. What exactly is testosterone?
Well, you got it. It's a hormone,
It is.
which basically means it's a chemical messenger
Right.
that travels around your body telling different parts what to do.
Got it.
And testosterone's got a pretty big job description.
I bet it does. It's usually associated with men,
Right.
but you mentioned it affects everyone, right?
Absolutely.
Okay.
While it's true that men produce more of it, both men and women need testosterone for a whole range of functions.
Interesting.
Think of it like a vital ingredient in the recipe for good health.
So it's not just about muscles and, manliness.
Right.
What else does it impact?
So much more than that. It's involved in building muscle mass and strength, yes, but also bone density, red blood cell production,
Wow.
even how your brain functions. It affects your mood, your energy levels, your sex drive.
Really?
The list goes on.
The list goes on. So what happens when someone doesn't have enough testosterone?
Yeah.
What kind of symptoms might they experience?
That's where things get really interesting.
Interesting.
And you might be surprised to hear that low testosterone can actually start affecting people way before they even reach adulthood.
Seriously, you're talking about kids.
Even earlier than that.
Right.
Believe it or not, if a male fetus doesn't produce enough testosterone during development, it can lead to underdeveloped or ambiguous genitalia.
Wow.
It really highlights how crucial this hormone is from the very beginning.
I had no idea.
Oh.
So then, obviously, during puberty, low testosterone must cause some issues too, right?
Exactly.
Because that's when hormones are going crazy anyway.
For teenagers, low testosterone can delay puberty or even prevent some of the typical changes from happening altogether.
Oh, wow.
They might not develop as much muscle mass or body hair as their peers,
Right.
and their voice might not deepen as much.
Makes sense. Puberty is all about those hormonal shifts. But I think what most people are curious about is what happens in adulthood.
Yeah.
What are the signs of low testosterone in grown-ups?
Well, a lot of people jump straight to thinking about sexual issues.
Sure.
And it's true, those are common.
Yeah.
We're talking about things like erectile dysfunction and a lower sex drive.
Right.
But low testosterone can throw a wrench in so many other systems, too.
Okay. So what else should we be on the lookout for?
You might notice a dip in your energy levels,
Okay.
feeling constantly tired and drained.
Mm-hmm.
Some people experience mood swings like they're on an emotional roller coaster.
Yeah.
It can even affect your focus and make it harder to concentrate.
Wow, that sounds pretty debilitating. Are there any physical signs besides the sexual ones?
Definitely. You might see a decrease in muscle mass, even if you're working out regularly. Your bones might become weaker and more prone to fractures.
Oh, wow.
And here's a curveball for you. Some men even experience hot flashes, just like women going through menopause.
Hold on, hot flashes in men.
It's true.
That's not what I expected at all.
And it just goes to show how diverse the symptoms can be.
Right.
There's this whole spectrum of things that low testosterone can affect,
Yeah.
which is why it's so important to be aware of the possibilities.
So if you're experiencing some of these things,
Yeah.
how do you know if low testosterone is actually the culprit?
Right.
I'm guessing it starts with a visit to the doctor, right?
Absolutely.
Oh.
A doctor will start by asking you about your symptoms and medical history.
Mm-hmm.
They'll also do a physical exam, checking things like your muscle mass, body hair, and reflexes.
So they're gathering clues like a detective.
Exactly.
Okay.
But the most important piece of the puzzle is a blood test.
Okay.
This measures the amount of testosterone circulating in your blood and gives us a clearer picture of what's going on.
And there's like a normal range, right?
There is.
What happens if your levels are outside of that range?
That's when things get a little more complex.
Well, yeah.
There's a general range that doctors consider normal,
Right.
but it can vary slightly depending on your age and individual factors.
Hmm.
If your testosterone levels are significantly low,
Yeah.
your doctor might recommend some additional tests
Okay.
to get a better understanding of what's causing it.
So what kind of tests are we talking about? What are they looking for?
Well, they might check the levels of other hormones
Okay.
that play a role in testosterone production, like
Yeah.
something called luteinizing hormone.
Yeah.
It comes from your pituitary gland,
Right.
which is kind of like the control center for your hormones.
So they're looking for the root of the problem, not just the low testosterone itself.
Precisely.
Yeah.
They're trying to figure out why your testosterone is low,
Yeah.
which helps them determine the best course of treatment.
It sounds like a pretty thorough process.
It is.
So let's talk about that treatment.
Okay.
If you are diagnosed with low testosterone, what are your options?
That's where things start to get really hopeful,
Oh, yeah.
because there are actually quite a few effective treatments available,
Okay.
depending on your individual situation.
That's great to hear.
Yeah, so we'll dive into all the different ways to address low testosterone.
Sounds good. This is fascinating.
It is.
And we're going to pick it up right after this.
Right after the break.
We'll be right back after a quick word from our sponsors.
Sounds good.
So we were talking about how doctors diagnose low testosterone. And I know a lot of you are probably wondering what comes next.
Right.
What happens if you actually get that diagnosis?
Yeah.
I mean, it can sound pretty scary.
It's understandable to feel a bit apprehensive, but I want to assure you that low testosterone, or hypogonadism, as it's formally known, isn't a life sentence.
That's a relief.
There are actually quite a few effective treatment options available.
That's good to hear. So let's break it down. What are some of the main ways doctors approach treating low testosterone?
One of the most common approaches is hormone replacement therapy, or HRT, which is often specifically referred to as testosterone replacement therapy, or TRT.
Right.
It's like giving your body a helping hand, replenishing the testosterone that it's not producing enough of on its own.
So it's basically supplementing what's missing.
Exactly.
That makes sense. But I imagine there are different ways to actually deliver that testosterone, right?
You're absolutely right. There are a few different methods, and each has its own pros and cons.
Okay.
Some of the most common options include injections, gels, and patches.
Let's unpack those a bit. Injections sound kind of intimidating, to be honest. What's that process like?
Well, with injections, you get a direct dose of testosterone, typically delivered into a muscle,
Okay.
kind of like getting a flu shot.
Okay.
They're usually given every 1 to 2 weeks, depending on your specific needs.
So it's not a daily thing,
Right.
which is good. But I guess you'd have to go to the doctor's office for each injection.
That's one option, but some people learn to self-administer the injections at home.
Okay.
It just depends on what you're comfortable with and what your doctor recommends.
That makes sense. What about gels? Those sound a bit easier to manage?
Gels are pretty simple to use. They come in a little tube, and you just rub a small amount onto your skin once a day,
Okay.
usually on your shoulders, upper arms, or abdomen.
Got it.
The testosterone is absorbed through your skin and gradually enters your bloodstream.
So it's like applying lotion. Pretty convenient.
Yeah.
What about patches? How do those work?
Patches are similar to gels in that they deliver a continuous dose of testosterone through your skin. They're usually worn for 24 hours, and then you switch to a fresh patch.
So injections, gels, and patches are the main players. Are there any other options out there?
There are a couple of less common methods, like implants and nasal sprays.
Okay.
Implants are tiny pellets inserted under your skin that release testosterone slowly over several months, while nasal sprays deliver the hormone through your nasal passages,
Interesting.
but those aren't as widely used as the first 3 we talked about.
Got it. So with all these different options, how do you and a patient decide which one is the best fit?
It really comes down to a personalized approach. We consider things like your individual symptoms,
Right.
the underlying cause of your low testosterone, your lifestyle, and your preferences. It's a collaborative decision between doctor and patient.
Okay, so it's not a one-size-fits-all situation.
Exactly.
What about cases where those traditional hormone replacement therapies aren't the best option?
Right.
Are there any alternatives?
Absolutely. For people who are looking for a shorter-term solution or have milder symptoms, supplements might be a good option.
Supplements, okay.
There are both natural and herbal supplements out there, as well as steroid-based products.
Now, it's important to note that supplements aren't regulated in the same way as prescription medications, right?
That's a crucial point.
So you really need to do your research and talk to your doctor before trying anything.
Absolutely not all supplements are created equal.
Right.
And some can even have harmful side effects if they're not used correctly.
For sure.
It's always best to err on the side of caution and get professional guidance.
Good advice. Now, we talked earlier about how low testosterone can sometimes be caused by an issue with the pituitary gland. What happens in those cases is the treatment different.
Yes. If the problem stems from the pituitary gland not sending the right signals to the testicles, then treatment might involve using pituitary hormones or medications that help stimulate the pituitary gland to function properly.
Okay.
It's all about addressing the root cause, as we talked about before.
It's like fixing the control center so everything else can run smoothly.
Exactly.
So we've covered HRT supplements and pituitary hormone treatment. Are there any other scenarios where a different approach might be needed?
There's one more important area to touch on, and that's assisted reproduction.
Okay.
For men with primary hypogonadism, which means the issue lies within the testicles themselves, simply raising testosterone levels might not be enough to restore fertility.
Oh, that's right. We talked earlier about how low testosterone can impact fertility.
Right.
So what are the options for those who want to have children?
In those cases, we might recommend assisted reproductive technologies,
Okay.
like sperm retrieval techniques or in vitro fertilization, also known as IVF.
IVF.
These techniques can help bypass the challenges posed by low testosterone and give those individuals a chance to become fathers.
Wow, that's incredible. So let's say someone starts treatment for low testosterone. What kind of improvements can they realistically expect to see?
That's the million-dollar question, isn't it?
It is.
The truth is, it varies from person to person,
Right.
but many people who undergo TRT experience significant improvements in their symptoms.
That's encouraging. So what are some of the most common positive changes people report?
One of the most noticeable changes for a lot of people is a boost in energy levels.
Makes sense.
Those who are feeling constantly fatigued and sluggish often find themselves feeling more vital and motivated.
Yeah, that's going to be life-changing for someone who's been dragging themselves through the day. What else do people notice?
Many men report improvements in their mood and emotional well-being.
Hmm.
Low testosterone can contribute to depression, anxiety, and irritability, and restoring those levels can often lift that fog and help them feel more like themselves again.
So it's not just about the physical symptoms, it's about improving your overall quality of life.
Exactly.
That's really powerful.
Absolutely. And of course, for many men, improvements in sexual function are a major goal of treatment.
Sure.
TRT can help boost libido, improve erectile function, and enhance overall sexual satisfaction.
That's a big one for sure. And I imagine the physical benefits go beyond that as well.
And TRT can also lead to increases in muscle mass and strength,
Okay.
as well as improvements in bone density.
Wow.
This can be especially important for older men who are at a higher risk of osteoporosis and fractures.
So it sounds like treatment can have a ripple effect, touching on so many different aspects of a person's health and well-being. But I'm guessing it's not all sunshine and roses, right? Are there any potential downsides to treatment?
You're right. It's important to be realistic. Like any medical treatment, TRT can have potential side effects.
Okay.
It's really important to have open and honest conversations with your doctor about those possibilities and weigh the benefits against the risks.
That makes sense. You've got to make an informed decision.
Yeah.
This has been such an eye-opening conversation.
It has.
We've covered so much ground.
We have.
But before we wrap up, I want to circle back to something you mentioned earlier about restoring fertility.
Okay.
You said that for men with primary hypogonadism, simply raising testosterone levels might not be enough.
Right.
Can you elaborate on that a bit?
Sure. For men with primary hypergonadism, where the issue is with the testicles themselves, sometimes raising testosterone levels alone doesn't solve the fertility problem. In these cases, we might need to look at other options, like sperm retrieval techniques or in vitro fertilization, often referred to as IVF.
So even if traditional TRT doesn't fully address the fertility issue, there are still options available.
Exactly. It's all about finding the right approach for each individual's unique situation.
Right.
It's important for men in this situation to work closely with a reproductive specialist to explore all their options and find the best path forward for them.
This has been an incredible deep dive into the world of low testosterone.
It has.
We've talked about the science, the symptoms, the diagnosis, and the various treatment options.
We've covered it all.
We have. But unfortunately, our time is flying by. We need to wrap things up. For this part of our show, we'll be back after a short break to share some final thoughts with you. Stay tuned. We've been on quite a journey today exploring this intricate world of low testosterone.
It has been fascinating, hasn't it?
It really has. It's amazing how much we've uncovered, from those surprising early signs to the cutting-edge treatments that are available today.
Yeah, and we delved into the science behind this vital hormone.
Yeah.
Explored the wide array of symptoms it can cause.
Right.
And even walked through the steps of diagnosis and treatment.
And I think one of the biggest takeaways for me is that low testosterone is not just about sexual health.
Right.
It can impact your energy levels, mood, body composition, so much more.
Absolutely.
It's really about your overall well-being.
It really is.
Yeah, it highlights how interconnected our hormonal systems are.
They are.
And how even these subtle imbalances can have these ripple effects throughout our bodies and minds.
Definitely.
Before we say goodbye for today, I kind of want to shift gears a bit and touch on something we haven't really addressed yet.
Okay.
We've talked about the medical side of low testosterone, but what about the societal implications?
Right.
There's a lot of cultural baggage that comes with this topic, especially for men.
Absolutely. There's definitely a strong societal narrative around testosterone, particularly for men. It's often equated with masculinity's strength and virility.
Right.
And when those expectations aren't met,
Yeah.
it can lead to feelings of shame, inadequacy, and even social stigma.
Yeah, it's like this invisible pressure to maintain a certain level of, manliness.
Yeah,
And if you're struggling with low testosterone, it can really make you feel like you're falling short of that standard.
for sure. And that's why it's so crucial to have open and honest conversations about low testosterone, demystify it, break down those harmful stereotypes,
Right.
and create a more supportive and understanding environment.
Yeah, it's about recognizing that low testosterone is a medical condition.
Yes,
It's not a character flaw.
exactly.
And like any medical condition, it deserves to be treated with compassion, understanding, and evidence-based approaches.
Couldn't have said it better myself. Knowledge is power.
It really is.
The more we understand about low testosterone, the better equipped we are to advocate for ourselves or our loved ones who may be dealing with it.
Absolutely. So if there's one thing you take away from this deep dive,
Yeah.
let it be this.
Okay.
Don't suffer in silence.
Right?
If you suspect you might be experiencing symptoms of low testosterone, reach out to your doctor. There are effective treatments available, and there's absolutely no shame in seeking help to improve your health and well-being.
It's about taking charge of your health and living your best life, regardless of what your testosterone levels might be.
Very well said, Grace. And that brings us to the end of our deep dive into the world of low testosterone.
That's right.
I hope you found this episode informative and empowering. I'm Ethan Reed.
And I'm Grace Morgan.
Thanks for joining us on KenkoVibe. If you enjoyed this episode, be sure to subscribe to our podcast for more insightful explorations into health and wellness.
We'd love that.
And don't forget to leave us a comment and tell us what resonated with you the most. We love hearing from you.
We do.
Also, if you know someone who might benefit from this information, please share with them. You never know who might be silently struggling and could use a little extra support. Until next time, stay curious and take care of yourselves.
Bye, everyone.